When I received that phone call, it was really scary. You know, my son was a high-risk baby as well.
Little Max was exposed to the measles in a BC hospital just days before he was supposed to be immunized. It meant he spent his first birthday isolated from his young cousins. Happy birthday, dear Max. Max's exposure to the measles virus happened because of another parent's unfounded fears of the link between autism and vaccines.
We were very angry, disappointed. You know, it's surprising that it's 2019 and we're now looking at, you know, a virus that had all been eradicated.
The science about the safety and efficacy of the MMR vaccine has long been settled, but the public debate has only escalated worldwide and online, and so have the measles outbreaks. Last year, measles in Europe hit a 20-year high. Canada and the U.S. are not far behind. And as this Ontario doctor found out, even discussing mandatory immunization can spin out of control.
Last year, a colleague and I were threatened quite seriously by somebody in the public who was furious about us even mentioning the word mandatory, to the extent that the police had to get involved.
Social media platforms are fertile ground for sowing the seeds of doubt about immunization. Just type the word vaccine in Facebook. Both Pinterest and YouTube are now trying to restrict anti-vax content. Canada's top doctor admits it's a struggle to counter social media's mixed messages.
We did not have a good idea of the power that they have, both for spreading good information and misinformation, and we're all trying to catch up to this.
Despite what vaccine-hesitant parents are reading on social media, this Winnipeg pediatrician manages to change some minds by listening.
You want to keep people engaged. I think the thing is you don't want to make them feel badly about it, and I'm sure half or more will eventually start to immunize, even the hardcore vaccine resistant group.
As for little Max, he finally got his shot, giving his mom peace of mind. Vic Adopia, CBC News, Toronto.